This segment is on the peripheral nervous system. It's going to take a little bit longer than normal because there's a lot of ground to cover. This is the same slide from the Intro to Neuropharmacology lecture. We're going to be focusing mostly on the autonomic nervous system. Same Dave is the mnemonic that helps me remember the nerve system response to a stimulus. So whenever a nerve receives a stimulus, they send an impulse to the brain and spinal cord. That signal comes through the afferent limb, sensory afferent. It arrives at the brain and spinal cord. From there, they make a decision as to what needs to happen, and that's called the motor response. It comes through the efferent limb as it exits the spinal cord and gets to the effector organ. So if you remember same Dave, then you can remember this whole system. Now notice that the sensory portion on the afferent limb is a straight shot to the brain and spinal cord, whereas the efferent limb has this little midway point called a ganglion. This is a depiction of the somatic versus the autonomic nervous system. What I want you to remember from this is that somatic is responsible for skeletal muscle, S and S. Other than that, autonomic is divided into the sympathetic and parasympathetic divisions, which are both responsible for different things. Here is that efferent neuron again. You'll see that the cell body is in this brain and spinal cord. It sends a signal down the preganglionic neuron, where then the signal is transmitted across the ganglion and to the postganglionic neuron to continue to the desired organ. The only thing I want you to remember from this slide is that the sympathetic is called the thoracolumbar and the parasympathetic is called the craniosacral, and the reason is because this is where the nerves will originate. Now this is a very busy slide with pictures from both lectures, both books, and it'll help you understand the autonomic and somatic nervous system. There are two major neurotransmitters in the autonomic nervous system, and that is acetylcholine and norepinephrine. The somatic nervous system has only acetylcholine and it binds to a nicotinic receptor. You'll also notice that acetylcholine with nicotinic receptors dominates the ganglionic transmission, so they're going to be present in all of these. So we're going to get rid of all this white noise and go to this terribly cropped picture where we can only focus on the differences after the ganglion. The postganglionic neurons of the sympathetic nervous system will release norepinephrine and bind to an adrenergic receptor. The parasympathetic will once again release acetylcholine, but they'll bind to a muscarinic receptor, and this helps us to determine what desired effects that we want. The adrenal medulla is the only other one that's just kind of abnormal. I want you to think of the adrenal medulla as its own ganglion. From there, it actually releases epinephrine and norepinephrine into the blood and does the same thing as the sympathetic nervous system, activating adrenergic receptor. So that's all you need to remember about the adrenal medulla. Here is just another depiction that shows you that acetylcholine dominates. There's one place for a muscarinic receptor, and then norepinephrine is in the sympathetic nervous system. Now, almost all of the organs in the body are innervated both by the sympathetic and parasympathetic system. It's like turning on a faucet. You may have mostly hot water on with a little bit of cold water, and vice versa. You will have both the sympathetic and parasympathetic on at all times. It just depends on which one dominates, which one's stronger, and that's the effects that you'll see. However, blood vessels are not that way. They are only dictated by a sympathetic response. So think of a water pump in the ground where you only have on or off. On, very high, trickling, or off. That's basically what happens with the blood vessels. Now, these are two charts that you can look at that help you determine what is a sympathetic and what is a parasympathetic response. However, I'm going to show you one chart that I believe that you should completely memorize. It summarizes everything that we've talked about and multiple charts within your books in order to understand the drugs and where they affect. Before we go to that slide, I want to take half a second to talk about second messengers. When that neurotransmitter reaches the effector organ, it does something to the cell. I apologize. The neurotransmitter can either bind to a receptor and cause the ion channel to open, changing the membrane potential or the ionic concentration within the cell, or it can deal with second messengers that are related to G proteins. The second messengers are often CAMP or phospholipase C, and that will make more sense in pathophysiology. But here's what I'm talking about in terms of the autonomic drugs. This is the chart that you need to memorize 100%. It looks like a lot of information, and it is, but at the same time, if you can memorize this alone, you will know all of the drugs in the peripheral nervous system. Now, here's the sympathetic system. This is normally norepinephrine on an adrenergic receptor like we talked about, and it will exert its effects on all of these organs in this way. The drugs that are going to mimic that are adrenergic agonists and anticholinergic drugs. Think of anticholinergic as anti-parasympathetic, so they're going to result in these actions. The parasympathetic system is usually acetylcholine acting on muscarinic receptors, and it will exert these effects. Now, adrenergic antagonists will result in these effects, and cholinergic drugs, or you can think of them as parasympathetic drugs, will do the same. Now, in terms of receptors, all cells that have parasympathetic innervation will have muscarinic cells. So, like I said, that's pretty much every cell in the body, everything that's innervated by parasympathetic, and it's just mainly this one receptor. There are 6 subtypes of that receptor, and I've listed 3 here. Other than that, just know that all the cells have a muscarinic receptor. However, the adrenergic receptors are a little bit more complicated. There are 4 types: alpha 1, alpha 2, beta 1, and beta 2. You won't see alpha 2 on this chart because it's actually more related to the central nervous system. However, the peripheral nervous system is dominated by alpha 1, beta 1, and beta 2. Screenshot this and commit it to memory because it will not only help you remember the sympathetic versus parasympathetic, but it'll help you remember the receptors and the drugs. If you want to, you can just cut out half of it and memorize one side and know that the other side does the opposite. Now we're going to take the last 2 minutes and just review the drug classes in this section. That is the cholinergic drugs with both muscarinic agonists and cholinesterase inhibitors. As you can see here, nicotinic receptors dominate. However, muscarinic receptors are in charge of most of the impacts of the parasympathetic system, and they're on basically every cell. Here you can see that acetylcholine has affinity for both nicotinic and muscarinic receptors at different levels. Here is the example of direct stimulation. Now this is going to be the muscarinic agonists. They're basically going to be the drug that sits right here as if it were acetylcholine, pretending to be that. As opposed to the indirect, which are the cholinesterase inhibitors, they're going to stop acetylcholine from breaking down. And like we talked about earlier, when you have a lot of neurotransmitter in this space, then you're basically keeping the system on. You've got to turn it off by breaking it down. However, these drugs are going to stop you from breaking it down so you can have a continued response. The anticholinergic drugs are listed below. There are a lot that are responsible for overactive bladder, but we'll cover those in another section. So these are the main ones. Like I said, they're going to act at every place that acetylcholine can. They're both nicotinic and muscarinic receptors. The adrenergic agonists are going to be your ephrins, your amines, and a few other drugs. These are going to work at the adrenergic receptors, and they're going to mimic the sympathetic system. Finally, the adrenergic antagonists. Now, these are probably the most important drugs that you'll learn throughout pharmacology. You're going to use them all the time, both alpha and beta, and we will cover those more in depth in their specific video. Thank you.